In the early 2000s, LA students needed more than classrooms. They needed healthcare. A few visionaries stepped in to bring a dormant nonprofit back to life.
What's been so interesting about the LA Trust for Children's Health is that over the course of decades now, the mission has not changed. When I was asked to rebirth the organization, it was apparent that the health needs of students in LA Unified, and actually their parents, was greater than ever. So we had this existing organization. Let's bring it back, expand the services, expand the reach, expand the access.
I got involved after meeting Jan Kern 25 years ago by chance. Joining the board was convenient for me because I was an LAUSD employee at the time. We were able to demonstrate that student health had a direct correlation with student performance. We knew that these young people, and many of whom did not have the same opportunities that some of us did.
It was very much kind of a germinating group that was starting something almost from scratch. And it was just amazing to see how much this small group of people were able to do. And that was in large part because they had Mary Jane as this charismatic leader who was just full of energy, and they were all really committed to something that they believed in and something that the board believed in.
I looked at the strategic plan and I thought, oh my God, this is what I know I can do. This is what I was meant to do in my life. But the idea about intersection of schools as a place of preventative care, early intervention, early access.
With almost no staff and little funding, the LA Trust began as an idea fueled by persistence.
I started with 4 interns and they were magnificent. Each intern wrote a grant. Each grant was funded. We were able to start really the first legs of the oral health program.
Today, the LA Trust stands as a national model. Its strength has always come from people, founders, partners, and young leaders who believe every child deserves the chance to be healthy, to learn, and to succeed.
I think anyone who's ever been in education will tell you, I can't educate a student if they're hungry, or if they're sick, or if they're depressed, or if they're not in a headspace where they can hear what I'm saying and participate and engage in a dialogue around the educational material we're talking about.
We had this vision, this almost a theory, a crazy notion that student health equaled student success, that there might be a way of showing that if kids were healthy and if their families had support, they would do better in school. What I am so delighted, thrilled about, is that we now have the data that shows that this is true.
The experience of being a board member is something that will be with me for a very long time. Knowing that our small efforts were able to make a big difference in these young people's lives. Tens of thousands who were able to avail themselves of healthcare at their schools and their more positive futures that they've been able to enjoy because of the work of the LA Trust.